Welcome back to the podcast. And if you're new here, I'm so glad you're listening. This is What the Health, Confessions of a Black Nurse, where we talk honestly about health, the things most people were never told, and how to think differently about your health without fear, urgency, or judgment. If you're between the ages of 35 and 65, juggling work, family, daily responsibilities, and trying to do the right things for your health, today's episode is for you. Most adults were taught that health is something you check once a year. You go to the doctor, you go get labs, you wait for a call, and if nobody calls you, everything's fine. But here's what most people are never told. Your body is giving you information every single day, not just at annual assessments. By the time something shows up clearly on labs, patterns have usually been forming quietly for years. This episode is not about becoming hyper-focused or anxious about your health. Think of this as learning how to listen to your body without learning to worry as well. This doesn't mean something is wrong. It means you're becoming informed. Let's get into this. All right, let's start with what conventional medicine does well. Yes, there are things that conventional medicine does do very well, and it is essential. I want to be very, very clear here that conventional medicine is essential. Conventional medicine is excellent at acute care, emergencies, diagnosing disease, managing complex conditions, life-saving interventions and measures, also with annual physicals and screenings and routine labs matter. They are not optional. All those things are necessary in order to be proactive with your health. But the healthcare system was never designed to track daily stress, to track our sleep quality over time, to track our subtle energy shifts and changes, to track lifestyle strain, to track early functional shifts. It's not a failure. That's just not conventional medicine's role. Okay? What functional and lifestyle add to conventional medicine is they zoom in on exactly what's going on to figure out where a pattern is. So functional and lifestyle medicine don't replace conventional care. They zoom in on it. Instead of asking only, is this number normal? They ask, what is the trend? Or what's changed? What's the body been adapting to over some time frame? Tracking becomes less about catching disease and more about protecting the capacity of the body. So, tracking by time frame. Physicians are trained to do and look at things in a frame of time to get an accurate picture or accurate inventory of what is going on. So, you should also be tracking so that you can provide information or so that you can listen to your body. Lots of times people are like, well, what am I supposed to track? How often am I supposed to track things? Like, what needs to be done? Well, we're about to break that all the way down into what you should be tracking right now. Okay, so what's commonly done in standard care or in conventional medicine, tracking usually looks like annual physicals and assessments or basic labs once a year, blood pressure and weights at each visit if you go more than once a year, screenings at certain ages, like doing a mammogram once you turn 40 or starting colonoscopies once you turn 45, something like that. And to be clear, all that is necessary and matters. But conventional medicine before the bub. And to be clear, all this matters. Conventional medicine excels at acute care, emergencies, disease management, managing complex conditions, and life-saving interventions. But Where people often feel frustrated with conventional care is that changes can be slow and subtle. Symptoms often show up before labs look abnormal. Lifestyle patterns don't always get discussed in depth, and our lifestyle has a huge impact on our health. That doesn't mean something is wrong. It just means that the conventional healthcare system was never designed for that, for daily and long term tracking. It was not designed for that. What functional and lifestyle medicine add to conventional medicine is a timeline, not just a snapshot. When you have an acute care visit, or if you're only going to your physician once a year, or whoever your healthcare provider or medical provider is once a year, you are just getting a snapshot of that time frame. Functional and lifestyle medicine, we want to see things over an extended timeline. So instead of asking, is this lab in range, which is what you would hear in traditional or conventional medicine, we also ask, is this trending in the right direction for you? Okay. And that's where tracking at different intervals becomes extremely powerful and telling of what your body is communicating to you. We also ask in functional or lifestyle medicine, what has changed? What's the body been adapting to? Tracking becomes less about catching a disease and more about protecting the current functional capacity of the body. Okay. So we know that tracking is important, but what are you supposed to track and when are you supposed to track these? And if we need a time frame to get good information, what time frame am I going by for what I'm tracking? So we're about to break that down. So let's walk through this slowly. Daily tracking, first of all, it's not about metrics. It's about signals, okay? Things worth noticing daily is your energy when you're walking, or your energy when you wake up, your energy midday, your energy in the evening when you come home from work, your sleep quality. When I say sleep quality, I'm not talking about how many hours you have slept. How good of quality was that sleep? Stress perception. Stress plays such a huge role in our body's ability to heal. And so we need to know what's going on stress wise for you in your life. Your mood, your hydration awareness, those are all things that should be tracked daily. Why? Your nervous system and your hormones are communicating with you daily. Okay. Labs do not. Unless you are getting poked every single day, your labs are not telling us what is going on with you on a daily basis. And it is only zeroing in on something specifically, not the entire person. Okay. Daily tracking helps you notice when your body is under recovery from something. It helps you recognize when stress is accumulating in your body. It helps you figure out when your sleep debt is building up. Okay. This doesn't mean something is wrong. Tracking is not diagnosing. It's not saying that something's wrong. It just means your body is communicating with you. And you have to know how to listen to your body because it's going to be with you for the rest of your life. It's yours. You got it. No one just drops dead. I say that all the time. Unless you have been in a traumatic accident or injury, no one just drops dead. If there is something going on in your body, like that's about to cause you to have a heart attack or a stroke, your body has been communicating with you. Your body has been giving you signals that something is wrong for an extended period of time. It's were you listening? Our bodies are amazing machines. They recover constantly from the BS we put our bodies through every day. When your body starts giving you signs like you're not getting good sleep, or you're starting to have a twinge in your back when you move certain ways, or you're running to the bathroom all the time, or all of a sudden you start not tolerating or able to digest food properly, that is your body telling you, I need you to help. I cannot recover from whatever you're doing to me, so I need you to either stop or help me help us. Your body's always talking to you. The question is, are you listening? Let's take a quick break, before we break down weekly, monthly, quarterly, and annual tracking. All right. Weekly tracking. Weekly tracking is where patterns start to emerge. Okay. This is where your awareness really starts to deepen. And instead of asking, how do I feel today? You ask, how did my body experience this week? Weekly reflections may include your digestive comfort or discomfort, consistency with your bowel movements, stress recovery, appetite changes, mental clarity. Most people overreact to daily fluctuations. Weekly patterns tell a much truer story. So you really shouldn't be overreacting to a daily change or fluctuation. Because, like I said, our bodies are amazing machines. They recover very well from the BS we put it through every day. But if something is happening for an entire 7-day period or a weekly period, that is your body not necessarily handling or adjusting to your BS as it usually does. So it's a much truer picture of what's going on with you. And you should pay more attention to that. Or if you want to get worked up about something, get worked up over a weekly trend, not a daily fluctuation. So monthly tracking. Monthly tracking catches those slow shifts or when our body's starting to go adrift a little. Okay. Things to reflect on monthly. Your weight trends and reflect on your weight trend without judgment. Before we go on to the next monthly thing, I just want to say something about weight. I have been a healthcare professional working as a registered nurse, a functional medicine practitioner, a health coach, an integrative functional medicine practitioner. And over my 20 plus year career, I have seen people stress about weight at every stage of life. Now, I am not a pediatric nurse. I the only care of people under the age of 18 have only been with my own children or family members, not in a professional way. I am a adult practitioner. I don't really do pediatrics and I prefer more patients 40 and up. But at every stage, elementary, which is so sad, middle school, high school, people are worried about their weight. They weigh too much. They don't weigh enough. They want to be more muscular. They want to be more thin. They don't want their thighs to be as big and this and that. They're worried about a number on the scale. Once you become an adult, the same thing continues. Did I gain too much weight when I was pregnant? Did I lose enough weight after I had a baby? You know what I'm saying? I recover properly and everybody is looking at a number on a scale to decide whether or not they're healthy. A number on the scale is just that. It is digits, they are numbers. They don't mean much more than that. I know people whose BMI is not optimal. It would be considered suboptimal per our scale, but they are actually very healthy. And I know people who have perfect BMIs, have bodies that we envy and strive for and have the perfect number on the scale, but they are very unhealthy. So stop beating yourself up. Give yourself some grace when you look down at that number on the scale because it's just that. It's only a number. It does not tell you whether or not you are healthy. And I would rather be healthy than a perfect weight. Just saying. Went off on my little tangent there. Now let's get back into this. So, monthly tracking. We're tracking our weight without judgment. We're tracking our blood pressure. And this is more so if it was previously elevated. If you check your blood pressure once a quarter and it's in a normal range and no device has told you that something's wrong with your blood pressure or something like that, then you don't need to even worry about necessarily tracking that on a monthly basis. But if blood pressure is something you are concerned about, definitely monthly is how you should track it, not just on a daily basis and not even just on a weekly basis. So, blood pressure, if previously elevated, sleep consistency, mood stability, menstrual or hormonal shifts. And one thing about sleep consistency isn't, are you consistently sleeping 6 to 8 hours a night? Or are you consistently sleeping 8 to 10 hours a night? It's great if you sleep 8 to 10 hours a night, but Not if it's poor quality sleep. If you never get into REM sleep, if you're never getting to a place where your body is able to start recovering, because that's what happens when you sleep. That's your body's time to recover from all the BS you did to it during the day. That's its time. So if you are not relaxing and actually getting into REM sleep and and getting a good quality sleep, it really doesn't matter how many hours you actually slept or you believe you slept. This is especially important to track things monthly once you get into your 40s and 50s. I'm 49 years old. I will turn 50 years old this year, 2026. Happy New Year to everyone, because I didn't say that at the beginning of my show. And when you are between your 40s and 50s, when changes happen, they are sometimes gradual, but they're much more meaningful during this decade of your life. Again, we are not diagnosing anything. This is just information. But when I turned 40, I was not in the best health, not in the best shape. And I felt like the day I woke up, 40 years old, some switch flipped in my body and it went haywire. I stopped responding to things. My body stopped responding to things the way it used to. Things I used to be able to eat, all of a sudden, it's giving me heartburn. My red wine, it all of a sudden became a problem. I'm exercising. My body is aching so much. And I don't necessarily have a sedentary job or a lifestyle. I am always on the go, always moving, walking constantly. And my body just couldn't handle all that walking anymore all of a sudden. I couldn't sleep. I didn't understand why I couldn't sleep. And I was doing all these different things and I'm taking melatonin and this and that. My body just went crazy. And it all started when I turned 40 years old. I decided I'm only 40 years old. I'm not going to feel like this for the rest of my life. It's not going to be downhill from here. So I started making changes. I had actually got all the way up to, I was like 225, 230 pounds. My heaviest. I used to always tell everybody it was baby weight. 10 years ago, my baby was 7 years old. So it was not baby weight. It was me being unhealthy and making excuses or normalizing why I was carrying all that weight, why I didn't feel good. And that is a huge problem we have, normalizing things that are not normal. But in regards to all the shifts that happened in my body, I completely started to change my lifestyle in my 40s so that I am this healthy person now at 49, entering my 50th year of life. I am much healthier and can do so much more because of the changes I made, because I was paying attention to the gradual shifts in things I saw in my body once I turned 40. When you turn 40 or somewhere during that decade, your story may not be the same as my health story. You may have some different feelings or issues or problems. But if you are in the 40 to 50 year decade of life, that is like your make or break time to make a choice. Make a choice. Are you going to get healthy or not? Because what you're doing between your 40s and 50s will greatly impact the quality of your life for however long you live. Now, let's talk about quarterly tracking and where lifestyle medicine starts to become strategic. Because quarterly tracking is a preventative strategy to keep your body functioning at an optimal level. So, quarterly, you want to reflect on things like your stress versus recovery and balance, or your energy sustainability, your nutrition consistency, your burnout signals. And that's when you also want to review your goals. Because I'm not someone who believes in doing something for a whole year and then reevaluate. I believe that either at a 30, 60, or 90-day interval, you should always reassess your goals. Because think about it like this. Say I put you on a blood pressure pill. You come to me and your blood pressure is elevated and we decide now it's time to start medication. And so we put you on a blood pressure medication, say a diuretic, and you start taking it daily. And I tell you to come back and see me in 90 days. First of all, if I put you on a new medication, I would never do that. Just saying. But say I did say that. I'll see you in 90 days. Because that is the typical response. You will typically get a refill for 90 days. If you're having problems, a physician assumes or your provider assumes you're going to contact them and let them know that you're having problems with it and will make a change. You probably should not assume that because the majority of the public does not do that. They just wait till their next appointment or they stop taking whatever we ask them to start taking. So you need to track for like a 30-day period or a couple week period. Track, are you having any side effects? Track, is your blood pressure actually getting better? Because if not, why would you take that medication for another 60 days, 75 days before I see you? That's insanity. If it's not working for you, it's not working for you. And you need to be paying attention to know so you're not taking something unnecessarily because everything you put in your mouth, every medication, over the counter supplement, whatever, it is doing something inside your body. Maybe good, maybe bad, but something is happening inside your body because of what you just put in. So we have to pay attention. For some people, this may also include labs if indicated. So, with your quarterly things that you're tracking, your medical provider may also recommend that you may have a diagnostic scan or you might have repeat labs, like if you're a patient of mine, if you take anything prescription or anything over the counter that is not considered a supplement. If you take anything over the counter, period. If you take anything over the counter or you take a prescription medication, I check all my patients' labs every 90 days because things happen in your body because of the medications or things that you could be taking. And I just want to make sure we're not causing another problem while we're trying to fix something. Or say you're taking a supplement to get your vitamin D to an optimal level. And then you get your vitamin D to an optimal level. And you've made the lifestyle changes you needed to make to keep your vitamin D at that level. And you know the signs and symptoms and you're listening to your body. You may not still need to be taking vitamin D every day. So it's not even as huge as, oh, it's a prescription medication. That's why I'm checking. It doesn't have to be a prescription medication. If you're taking Benadryl every day, first of all, I got to figure out what you are allergic to. And secondly, you cannot take Benadryl every day for the rest of your life. That's insanity. We have to figure this out. And until we figure it out, quarterly tracking is what makes sure the interventions that we're putting in place and the changes that you're making in your life are actually working. And if they're working, you probably will need to change something else because you're getting better. That's why quarterly is important. Now, let's talk about annual tracking. Annual tracking is the big picture health. That's when we're looking at everything, your big goals, your small goals, everything. Annual tracking includes things like your preventative screenings, like mammograms, colonoscopies, things like that. Routine labs. So that would be a comprehensive metabolic panel, maybe a hemoglobin A1C, a thyroid panel, your cholesterol panel, things like that. Those are the routine labs. Medication reviews. If you do take any prescription medications, supplements, over-the-counter medications, if it is something that is a pill or a liquid and you are putting it in your mouth and it is not considered to be food, your doctor should know and you guys should be reviewing it. And I say your doctor or provider should know everything because we cannot instruct you on the proper labs to check or things to watch for if we don't know what you're taking. And taking one supplement without another supplement can cause deficiencies in other areas. But we also want to know, too, your family history updates. As you age, you're going to learn things about your family's health that will become important because it may be a genetic thing that you have to pay a little more attention to. When you track all your annual medical visit with your provider, and a provider could be a functional medicine practitioner, an integrative medicine practitioner, a nurse practitioner, a doctorate of nurse practice, a DO, a MD, a naturopath, whatever you use as your medical provider, your visit's going to become so exciting. It's going to become so much more valuable. It is wild because the visit becomes so much more collaborative and it becomes personalized and you're not going to feel rushed. And you're not gonna feel like you're starting from zero. The doctor's not gonna feel like they're starting from zero, having to pull all this information out of you because you're not just sharing it. It just becomes such a more productive and proactive visit. And that is when you really can zero in on, are you healthy? And if you're not, or you don't feel like you're healthy, you come up with a new plan. It's about changing how you communicate with your body. Tracking should help you notice early shifts, advocate for yourself more confidently, make decisions based on trends, not fear or a social media trend or some influencer that says they're an expert that's never taken care of a person a day in their life. You can see that's a pet peeve of mine. It doesn't mean something is wrong. It just means you're paying attention and learning how to communicate with your body and listen to you. You've collected all this data. You've been tracking daily, weekly, monthly, yearly, and you have all this damn data. What are you supposed to do with it? I went to school for a long time to learn how to interpret that data, as most providers have. So how are you interpret if you haven't had all the education and training you've had? We're going to get into it right after this break.
Using health data without stress, obsession, or self judgment. First, an important reframe. You do not need a wearable device to be healthy. Wearables are optional tools, not requirements. They are meant to support awareness, not replace body wisdom. Using one does not make you more disciplined. Not using one does not mean you're ignoring your health. What wearables are good at wearables are most helpful for noticing patterns over time, such as sleep duration and consistency, general movement levels, resting heart rate trends, recovery or stress indicators. They are best used to answer questions like, is this changing over time? Does this trend match how I feel? They are not designed to explain why something is happening. What wearables cannot do. It's important to keep expectations realistic. Wearables. Do not diagnose medical conditions. Do not replace medical evaluation. Do not always reflect lived experience accurately. Use estimates and algorithms, not clinical judgment. A single data point does not equal a problem. Choosing a wearable using a mindful approach. If you decide to use a wearable, consider these questions first. 1. What do I actually want to notice? Sleep, movement, general recovery, stress patterns. More data is not always better. 2. How do numbers affect me emotionally? Do they motivate me or do they make me anxious or self critical? Your emotional response to data matters just as much as the data itself. 3. Will I wear this comfortably and consistently? The best device is the one that fits your life, not the one with the most features. A healthy way to interpret data. Use this mindset when reviewing wearable data. Look at weekly or monthly trends, not daily fluctuations. Compare data to your own baseline, not someone else's. Let data inform questions, not conclusions. Check in with how you actually feel, not just what the device reports. If your body and your wearable disagree, your lived experience still matters. Common data traps to avoid. Be mindful of these patterns. Checking data multiple times per day, letting one bad score define your mood, ignoring how you feel because the device says you're fine, feeling guilty for not meeting a metric. Data is information, not a moral judgment. When it may be helpful to take a break, it's okay to pause or stop using a wearable if you feel anxious or preoccupied with numbers, you notice increased self criticism, the data feels overwhelming, you're ignoring your body's cues. Taking a break can be a form of self care. Using wearable data in conversations. If you choose to discuss wearable data with a healthcare provider, focus on trends over time, how the data matches your experience, questions you're curious about. Example, I've noticed this trend over the past few months and wanted your perspective. Key reminder for Vitality Catalyst members. Wearables are meant to support awareness, not create pressure. Noticing patterns is enough. You don't need to fix everything you notice. You may journal or reflect on this. How does tracking or not tracking impact my relationship with my body? There is no right answer. The goal of using wearables isn't control, it's understanding. And understanding grows best in calm, not urgency.
All right. So let's get into having a conversation with your provider. And this is the thing I'll say about the provider conversation before we get into it. You have to be able to communicate with your provider. If you can't communicate with your provider, I get a lot of patients from other practices. And one of the things I hear frequently, unfortunately, is I could not have a conversation with my last provider. I felt like my last provider wasn't listening to me, or my last provider would constantly gaslight me or say what I was experiencing wasn't what I was experiencing. Unfortunately, that happens. And if you have that type of provider, you need another one. You really do. And I do have my next episode after this one is actually going to be about medical gaslighting, the impact it has on you as a patient, and how to deal with it without impacting your care delivery moving forward. I have created a provider's cheat sheet conversation cheat sheet that is accompanied with this episode in the show notes that'll talk about how to talk to your healthcare provider about the healthcare data that you have collected. But truly, these steps are steps you should use, period, when preparing for a visit or preparing to have a conversation with your provider. This sheet is designed to help you use their tracking information productively and respectfully and confidently while staying firmly in an education first and non diagnostic lane. You can reinforce. I use this inside of my practice to help my patients prepare for their visits before they come see me, because I want them to feel confident, to be comfortable talking to me. I actually use this tool that I'm providing you. I actually give it to my patients. It's emailed to them before their appointments, usually a week before their appointments, with their confirmation so that they can prepare for the visit if they choose that. It can be as productive as possible. Feel free to use this cheat sheet. Most adults track things, even informally, but don't know how to translate the information into a medical conversation. This tool will help you advocate without confrontation, ask better questions, share trends instead of complaints with your provider, and strengthen the provider patient relationship. This isn't about challenging your provider or telling your provider what to do. It's about helping them understand your lived health experience or your lived health story. When you're preparing for the appointment, before the appointment, there are 3 things you should do. Doesn't require a ton of preparation or none of that. 3 basic things. 1, if you've identified a pattern, write it down so that you're sure that you guys discussed that. So if you notice that your energy is dipping most afternoons, your sleep feels less restorative over the last year, your stress recovery is slower than it used to be, you noticed a pattern, not a single bad day. Write down when the pattern started, whether it's still ongoing, and questions you have around it. You can write it down. You don't have to type this up or nothing like that. Just write it down on a piece of paper, because you're preparing for yourself, not preparing for someone else. Second thing you do, note the time frame, like I said. Providers think in timelines. We have been trained to think in timelines. We have been trained to not panic from something that happens one time. That is a daily fluctuation. We're trained to ask questions, to think in time frames. Like, I do everything, like my time frame always revolves around the number 3. I'm always the last 3 days, the last 30 days, the last 60 days, the last 90 days, the last 3 months, the last 3 years. When I do a family history, I need to note that because it could be identifying a hereditary component. So I asked them to think back 3 years. Has anyone passed in the last 3 years? An aunt, an uncle, a cousin, a brother, a sister, a mother, a father, and what did they pass from? Because that could identify some. My number is 3. because I've been trained to think in time frames. To me, if something has negatively has gone on for 3 days, it's time to act or do something. Or if something has went positive for 3 days, it's time to continue and possibly add another. Decide the goal of the conversation. Before you have a visit with your provider, you should, like, what is the goal of the visit? Do you is your goal to decrease the medications and over-counter things that you use? Is your goal to lose 10 pounds? Is your goal to gain 10 pounds or gain muscle? Is your goal to get a lab value that is not in a normal range or optimal range for you into an optimal range? You want to have a goal for your visit. And this is not just with like an annual visit, for any visit. If I go to an urgent care visit because I have signs and symptoms of a possible sinus infection, my goal is to have my sinus infection confirmed and treated if that's what it is. And if it's not what it is, come up with a plan to figure out what this is. That's the goal of that visit. So you should always have a goal for yourself of the visit, and you should make your provider aware of that goal. Because if we don't know, first of all, providers are not psychic. So many patients think we are, but we're actually not. We cannot read your mind. I know it's mind blowing, but it's the truth. So we don't know what your goal is. Just because you're what the world would consider overweight, I'm not going to assume you want to lose weight. You may be very happy in the body you're in. You know what I mean? So I am not going to assume that you want to lose weight. So you have to communicate the goal, your health goal, or the goal of today's visit with the provider. When the medical assistant or the nurse comes in and is gathering information before the provider starts the visit, they always ask, is there something else you wanted to talk about today other than the typical reason for your visit? That's your time to say, well, my goal is to do XYZ over the next year to reach this health goal. So I really want to talk about things I need to do to reach that goal. Great. That gives her concrete information that she can give to the provider before he comes in the room, so that he or she comes in the room so that they can make the most of the time that they have with you. And this is when your visits start to stop feeling rushed, because everybody is on the same page. Okay? Goals, this keeps, like I said, the visit focused, and possible what goals could just be. It doesn't always have to be help me get to this. It could be, I saw that my vitamin D level is 25. Normal vitamin D level is 30 to 100. Some say optimal is 50 to 100, but 25 would be below optimal or abnormal. So I just need clarification on what that means. I've been tracking these things over the last year. Another possible goal way to frame it. I've been tracking these things over the last year, or monitoring these things over the last year. And this is the data that I got. Based off of this data, what should I track over the next month, or over the next quarter, or over the next year? So they can help you figure out what to track based off of what you tracked from the last year. Another possible goal could be just understanding the next steps. Sometimes based off of the data that you collected, the next step may be lab work. The next step may be a diagnostic test, like a chest x-ray or a MRI. The next step may be physical therapy or occupational therapy or seeing a dietitian. So this is a way to get clear on the next steps. Another goal could be for the visit, deciding whether something needs follow-up. So say your vitamin D level was a little low. It was 25. How should we move forward? If I start taking a supplement, or you recommend a supplement to me, and I start taking it however many times a day or at whatever dose, when should I follow up? And what should I be watching for until I follow up to know whether it is working or not working? I think that is a huge question people need to start adding to their vocabulary at the end of a visit. Not just, do you have any questions? Do you have any questions? Yes or no. Do you know what you need to do once you leave the office in regards to this medication? Do you know what you need to do once you leave this office in regards to the lab works that I told you to do? Make sure people are clear on the follow-up, because a lot of times the patient thinks they're clear on the follow-up, and then a couple days later, I'm the provider and I'm like, how come this person hasn't scheduled this yet? Or how come they haven't scheduled that lab? Or if he's wondering how come they haven't contacted them to set up a time to get started, because the patient didn't know what they were supposed to do for follow-up after the doctor told them that that's what they were going to do. So the goal of the visit could just be getting clear on the follow-up. But there should always be a goal, and you and the provider should know to go. Here's some openers to start conversation. These openers keep the tone collaborative and calm. They're like low friction opening statements. I've been paying more attention to my health patterns and wanted your perspective. This may be nothing, but I've noticed a trend I'd like to understand better. I'm not worried. I'm just trying to be proactive about. These are all phrases that lower defensiveness and invite collaboration or partnership with your provider. I'm giving you the words to start the conversation. And if you have to look down and read from your paper word for word during your visit, then that's what you should do, because get your money's worth. You are paying for this visit. Even if you didn't literally pay cash money or with a card or something that day in the office, it is either coming out of your paycheck, it's coming out of your social security check, somewhere you have paid into this benefit. That is why you are seeing this person, or you could have self-paid cash pay. So get your money's worth. Those phrases invite your provider to help you get your money's, because everybody does not want it. When you are going to share the tracking information with your provider, I always tell people to try to summarize it and send it to your provider in an email or through your e-chart, because any physician that has an electronic medical record system or an EMR, which there are not too many providers that don't, because it's mostly mandated by law in the United States. There are a few exceptions, but so they all have electronic medical records. So since they have the electronic medical record, you can communicate with your provider through there. They all have like an email function or a chat function or some type of function where you can send a message to the physician's nurse or a message to the physician's team, and they will follow up. And it's actually, being a nurse and a provider, it is such a easy way for us to follow up with you. It is so much simpler than the phone calls and the back and forth and trying to call at the right time and remembering to call throughout our busy day as things come up. You at home, quiet, with your head clear, your notes gathered, can send a nice email message summarizing everything you tracked and send it to your provider and say, when I see you next week, I would like to talk about this data. Please let me know if you have any questions before the visit that I can answer. That's great. And a lot of times, if you don't know how to summarize just put all the data in there. Just put, I notice this is happening on the weekends. I notice this happens every weekend. I notice this happens once a year during this time of year. I'm very stressed at work, blah, blah, blah. Just put whatever you want them to know. They will interpret it. If you don't want to sound like a crazy person just rattling stuff off, speak that stuff into like a chat GPT or any type, or Gemini or Alexa or any of these chat models that can summarize things very quickly. They almost all have a microphone feature where you can just speak. These are my symptoms that I've been having, or that from all my tracking data, this is the information I have. Please summarize. And they will summarize it, and then you can just copy and paste it into an email for your physician, or copy it and paste it into an email to yourself, and then you can forward it wherever you want to, so that your provider has the information before your visit, because then it makes your visit even more productive because they're more prepared because they knew what you wanted to talk about. That is a way to really start the conversation and how to share the information. You do want to avoid listening to daily fluctuations. Like, don't put every daily fluctuation in your summary because, like I said, fluctuations are just a snapshot of a moment. It's not a trend, it's not a pattern, and it doesn't give a lot of information, especially if it didn't keep reoccurring because your body corrected itself. It dealt with the BS you did that day. Don't lead with fear. Don't be afraid of what your body is telling you. Your body is yours. You're not going to be able to trade it in. You can't switch it. It is yours until the day you leave this place. So don't lead with fear. Just lead with curiosity and in a desire to learn more about this body. And then ask for tests without context. You don't have to tell me, well, I've been having this symptom, so I want my vitamin D checked. I read that these symptoms could possibly be this, and so I want my thyroid checked, or I want my hemoglobin A1C checked because everybody in my family is diabetic, even though my sugars are normal. First of all, you don't have to explain anything to anyone. If you have health insurance and your insurance will cover it and there is a reason for it, or if you want to privately pay out of your own pocket for something to be done, your provider should order it. Say you come to me and say, I want to start a magnesium supplement, but I would just want to know what my magnesium level is before I start that supplement. Can you please order a magnesium lab for me so that I can go get that checked before I start this? If your doctor doesn't do that or won't do that or feels like you're being irrational because of that, you probably need a new provider. Okay. But it's very simple to do that and set that up. A lot of times, if it's coded properly, and when I say coded, I mean um, there's codes that go with every diagnostic test to tell your insurance company why we're doing the test to have them pay for it. It's our justification for why they should pay for a specific test or a lab or whatever. And all of those reasons why have codes. If it is not coded properly, sometimes the patient may end up paying out of pocket. But if it is coded properly, a lot of times it's not even charged out of pocket. That's how you can ask for tests without context. Just say, you want this test, this lab test. You want to check this lab test. You don't have to give an explanation why. If the provider becomes defensive or doesn't want to do it, they just did you a favor. They told you that they're probably not your guy or your gal, and you should find another provider. Patterns are more helpful than perfection. Always remember that when you're gathering your information to share. You're looking to share patterns. And also, you don't just have to share the things that are wrong, share the stuff that's good too. I have had regular bowel movements all year. I have had good quality sleep for the last 90 days. I've been able to sleep at least 8 to 10 hours a night and feel rested when I wake up. I haven't had problems falling asleep. So don't only communicate the things that are not optimal or things that you may consider troubling or abnormal. Communicate the good too, because the good tells us a lot. The good tells us just as much as the bad. And celebrate your wins. Questions that fit a supportive, collaborative role. These questions align with both conventional and functional medicine perspectives. So it doesn't matter what type of provider you're seeing, these questions work with whoever you're seeing. Is that something worth monitoring? At what point would this become more relevant clinically? Are there lifestyle factors that commonly influence? Questions that support the collaborative role. These questions align with both conventional and functional medicine perspectives and will help any provider, regardless of who they are, with the getting on the same page as you to help you meet your goals without causing anxiety. Is this something worth monitoring? At what point would this be more relevant clinically? Are there lifestyle factors that commonly influence this? What changes would you want me to make before you reassess this? Those are all questions that signal you are involved and signals engagement and gives clarity on next steps and can be applied to almost any problem or issue that could possibly be going on. When labs are discussed, stay grounded. Here's some language to use when you're talking about blood work or lab work. I'm curious how this lab fits into my overall picture. Is this something we'd recheck over time, or is this just a one-off? What trends would matter most in regards to this lab? All those questions reinforce normal doesn't always mean optimal, and optimal doesn't always mean okay. All those questions say that I'm paying attention, I'm not overreacting, but what should I be watching? That's what those communicate. If your provider happens to not be concerned, unfortunately, this is more common than it should be, but it doesn't mean your visit was a failure. You can use some respectful follow ups to try to get what you need out of the visit. Some of those respectful follow ups would be, would it make sense to revisit this in a few months? What changes would you want me to reinforce in my lifestyle to reach a normal level? Is there anything I should keep an eye on? All those questions invite the provider to tell you exactly what they believe you should be doing at home or paying attention to over the next few months or few weeks so that you can get a clearer picture of what's going on with your health. It keeps the door open without pushing the provider to respond the way you want. And at the end of the visit or closing the visit, you want to leave with clarity. Like I said, do not walk out of there with any questions. I see patients all the time. When I was a home health nurse, I would see patients in their homes, and typically I would always be helping my patient prepare for a medical visit because I usually knew when their visits were. I would usually try to see them within 24, 48 hours before their provider visit so that we could gather information. I'd usually write a note with questions that they had, made sure that they had a current medication list, things like that to make the visit productive. Then when I go see them after the visit to say, how'd the visit go? Well, he said, I have this. I said, well, what did he say that means? I don't know. I didn't ask. He didn't explain. The next thing out of my mouth is, did he ask you or did your provider ask you if you have any questions before they before they left the room? And they said, yeah. And what did you say? I said, no. I said, but you have questions. You told me they didn't explain this. They said you have this, but you don't know what to do. Now you have questions. You have to leave your visit with clarity. When the provider asks you, do you have any questions before they walk out of the room? Or a nurse asks you, do you have any questions before they leave your room? They're not just saying that as like some kind phrase or some type of parting greeting. They're saying it because they actually want to know if you have any questions. We literally chart that. We asked you if you had any questions regarding your diagnosis or regarding your treatment or regarding your discharge from the hospital. And patient verbalized that they don't have any questions. Patient nodded. They do not have any questions. We document that. So if you have questions, ask your questions. Do not let that person walk out of the room without having clarity on what you're supposed to do next. This reinforces the shared responsibility and the trust that you have in the provider. Okay? Way to do this when you're closing the visit. What's the one thing you'd want me to pay attention to before our next visit? Simple as that. Get your money's worth. Leave with clarity, not questions. Having a thoughtful conversation with your provider doesn't mean something is wrong. It means you're engaged in your health, and that's a strength, not a problem. If this episode resonates with you, pick one thing to track weekly. Look for a pattern, not perfection. Bring in trends, not isolated days, and talk to your provider if you feel like it's a problem. Ask questions instead of jumping into conclusions or jumping to conclusions and catastrophizing or, I'm sure I said that wrong, but you know what I'm trying to say. Instead of sending yourself into a full-blown panic attack, just question without urgency, without pressure. You just want to become more aware. Thank you so much for spending this time with me today. If this episode helped you think differently about your health, please like it, share it, follow the podcast, leave a comment, and rate it. It only takes a moment and it really helps push the podcast out to people. This show is free, and those small actions truly help more people who need calm, honest health conversations. If you like deeper support, you can join Vitality Catalyst, which is a program I created that it's an education-based membership where we explore all these topics together in a supportive and overwhelming way and help you attract things and get in the moment feedback based off of what you're tracking and what your health goals. And if you're interested in becoming a patient in my practice, because I am accepting patients, I have a virtual practice. We see people in all 50 states. You'll find the information on how to schedule an appointment in the show. Everything is invitational, though, never urgent. And if nothing else, find someone who will help you write the health story that you want to. Until next time, take care of yourself and remember, paying attention is one of the most powerful forms of prevention and self-care. Be well.